spray for is the live one, but the shots are always inactive. They're attenuated.
Do you
They
get,
don't
do you
do
get sicker if you get the live one?
it. Not normally.
Okay.
Not normally. We usually reserve that for kids.
Yeah, I
for
can't.
some
I have
reason.
asthma.
Yeah,
I can't.
Yeah, so you
Does
can't
it
do
still
that.
matter if you have an allergy to sulfur? Does that still matter?
No, what the
No, I have
allergy
flu
with
shot.
flu shots are
I'm
eggs.
aware.
Okay, we grow our flu virus in eggs. So if you have an allergy to eggs, you can't take a flu shot.
Right.
That's what it is. Sulfur isn't usually the
Oh,
common
it's
one.
not. That's
No, I had a
what it
flu
is.
shot,
So,
so I'm set.
So that's really the flu. The other antibiotics. No, again, just be aware of allergic reactions. Some of them you want to take with food, like the doxycyclines, and just look at the containers. You know, kids that take doxycycline for allergy, if they don't take it with food, they puke a lot. I mean, it really just is. It's not good that way. And the only other thing is some of the sulfur drugs and some of the tetracycline drugs will cause what's known as a photosensitivity reaction. What that simply means that you burn really easy. It makes you really susceptible to sunburn. So if you've got folks going out on a trip in the summer and some of them happen to be on an antibiotic, just double check to make sure it doesn't cause that, and you want to smother them with sunscreen if you can do that. Okay. It's antibiotics. That takes us all the way down. Actually, we already talked about the Parkinson's drugs. They block acetylcholine all the way through page 9. And takes us over to page 10. We don't have to talk about in the antiplatelets. That's again another drug for thinning the blood. We don't. That's Plavix. You've seen the things for that. The next several categories we actually talked about the antipsychotic drugs. They block the dopamine. We talked about those. Lithium is a little bit of a drug by itself. Lithium treats manic behavior. Somebody we used to call bipolar. Now we don't really call it that.
What do we call it?
I can't remember.
Behavioral disorder?
No, we.
Manic behavior.
Oh, I'm sorry. We call it bipolar. We used to call it manic depressive.
Okay.
Okay, now we call it bipolar. I'm sorry. But that treats the manic phase of people who have bipolar disease. And the thing about lithium, the only thing you really need to remember, well, there's several, but the major thing is you want people to be very hydrated. Okay? It's an electrolyte, so if they get dehydrated, you can get toxic from it. So you want to make sure plenty of fluids if people
You
take
can lower your
lithium.
thyroid level.
It can do that too.
I just read that
Yeah,
hypothyroidism.
That's
Yeah.
what happened to my brother.
Okay. The typical antipsychotics, those drugs are the old drugs we used to treat behaviors with. We don't really use them very much anymore. Occasionally we use Haldol, but lots of movement side effects with those, just terrible. We use Haldol lots of times end of life to control behaviors then, but a lot of movement side effects, or stiffness with Haldol.
The Haldol tongue.
Oh yeah.
Hanging out,
That's
yeah.
right. And the two other quick things. Chlorpromazine, which is brand name Thorazine, that's an old time drug. We use that to treat hiccups. Don't ask me why, but if somebody gets a chronic case of hiccups that you can't stop, they'll give them Thorazine and it'll knock it down. Okay.
Well, that must be a muscle thing too, because
It must
doesn't the
be.
tongue hang out with Thorazine too?
Oh yeah, absolutely.
Yeah,
Yeah,
big time.
absolutely.
Must do something.
And here's what you have to. What happens with the older drugs, and sometimes with the newer, but most of the older, people will go into where they start. You'll see a little twitch like this, and you'll start to see the tongue go like this. Okay, those movement side effects can be really dangerous. Okay, they can end up full blown like this, irreversible. When they start those. So if you've got somebody on an older drug, and we just don't see it much anymore, but in case you do, I used to always watch when those people came in when I was doing retail pharmacy to say, is there anything funky about that as they talk? Can I see a twitch in their tongue? And then that's where you go, and that is totally irreversible. Once that tongue's hanging out, it just doesn't go, and then you end up like this, and it's just terrible. So watch for those kinds of side effects with that, because you may see it's called tardive dyskinesia. That you may see with those. Okay. The anti-rheumatic agents, those are all injections they use for rheumatoid arthritis. You won't be dealing with those. Anti-thyroid agents, not much to say. If you've got somebody who has too much thyroid, which is rare but it happens, they give PTU, propylthiouracil, to block the action of the thyroid. The next category, this is the Ativan category. On top of page 11, the benzodiazepines. Okay, I just want to say a couple things about this category. Number one is there are long-acting and short-acting benzodiazepines. Ativan or lorazepam is short. clonazepam, which you may see, is long-acting. We really wanna see our folks on short-acting drugs like this, okay? Because when you give a long-acting drug, a clonazepam or something, to an elderly person, a drug will hang around a lot longer than it's supposed to, because all of their functions are down. So what happens is, we give them those, and we really have to be on guard for falls, okay? Because people on those
Again,
drugs
she
will
takes
tend
the-
to fall.
Take the long-
Yep.
So if you see somebody on a Klonopin, or even an Ativan, they'll fall. But Klonopin, we see falls with it. So just be aware, and I don't know if you can convince somebody to get her off or get her onto a shorter
That's-
acting
that's
drug
two
is
of
what
them
is
now.
what we
I've
wanna
done
do.
that.
You fallen?
Oh yeah, I
Yeah.
have like a long walkway at my house. And
Sure.
I've taken,
Yeah, even
yeah,
Ativan will
and
do
I
that.
took it's like a long cement walkway.
Yeah.
And
But see, again, we wanna
It's
prevent those
not good.
falls, because like I told you before, any breaks over 75 can be really deadly, so. And here's one aside that has nothing to do with the elderly. Is anybody afraid to fly?
I've
Never
never
been
flown.
on
it.
Well, let me tell you something. My wife is petrified to fly.
I will be sitting.
I mean, petrified. We've been married 31 years. We've flown together 4 times. Okay? Only because she had to. And so finally I said at one point we had to fly. I wasn't driving. She literally drives all over the country to see my kids. She'll drive to Tennessee to see my kids. Or drive, my son was in Alabama. She drove to Alabama because she won't fly. But anyway, finally I said, babe, you gotta do something. I said, you know, we'll get you some alprazolam, which is a really good drug for fear of flying. And I convinced her. I got her to fly to Korea with me, so I told her when I booked the flight to Korea, I'm in seat 2, you're in seat 50. But, anyway, so she tried the alprazolam, and it does a wonderful job. The first time she tried it, we're sitting in an airport, and have you ever seen, you know the doors, the alarm doors in an airport, if you've ever heard one of those go off, they take you out of your skin. I mean, so we're sitting there, and somebody came through one of those doors behind us. I about went through the ceiling, and she looked at me and said, did that make you jump? so just be aware, it does a really nice job for flying, so this is kind of an aside for that. So,
Yeah, when I was younger, I used to take a tranquilizer.
yeah. It does a good job, so
Yeah.
anyway, but that's just kind of an aside. Buspar, which is the other anti-anxiety drug, it works in some people, doesn't work in a lot. We're seeing more and more of it, but if it works for you, it works well. If it doesn't, it's
Don't they
a
use that for
funky drug.
PMS too?
I don't know.
I've been on it for something, but I
Yeah.
don't know
Yeah,
what I was on it
well,
for.
we can, yeah.
Something,
I've been
yeah.
on it for a lot of things.
We won't tell any PMS jokes, but
No, I think
do
you
you know how
do,
many
or
people with
something.
PMS it takes to change a light bulb? 1! Sorry.
Yep, that was recorded.
Sorry, I thought you picked you up a little bit. I usually take a break now. Do you want to keep going and finish, or do you want to take a
Break time.
Take 5 minutes? Okay.
Break time.
I was just thinking.
Oh,
yeah.
Good.
Quick butt.
Okay, I've got that hour window, an hour before, an hour after of medication. Now it's 9 o'clock. It's now 9:15. I'm out of the window. Do I give the medication? The answer is yes. Okay, even though you're out of compliance, you still want to give that medication.
How many hours
Okay.
up until after though, if it conflicts with another
I think I'd look at what there's no hard and set rule. I mean, if you forget it all day, it's 4 o'clock and they got another dose coming for 5, obviously you're not gonna give that,
Right.
okay?
Use your judgment.
But you gotta use common sense. If it's a once a day, I'd probably give it.
But our policy would tell you that you have to contact the nurse.
Absolutely.
And the nurse then would make
Right.
the call.
Yeah.
We cannot ever hold a dose.
Mhm.
We can't take it upon ourselves to say, well, it's too close to the next one, so I'll hold it.
Actually call
Then
us
we're
out.
way out. We can't do that.
Yeah.
So then we
Well,
call
that's
the
right.
nurse, and the nurse then can make a nurse call on that. But we absolutely have to give the
'Cause I
med.
think Thomas can have it up to what, 2 o'clock, isn't it?
Alex set up until 2 o'clock in the morning. He can have his meds.
And
So-
then you note it in the
Well,
book that the nurse can.
Yeah, yeah.
Right,
Just cover
and,
yourself.
and then note it in the communication book
Mhm.
too, that why it was a
Yeah.
half hour beyond the
Yeah.
allowed time or something else, you know, whatever.
And the state is never gonna hit you for an occasional thing. It
No.
happens. As long as you're covering yourself with drugs. But if they see every day you're screwing up and out of compliance, they'll say, well, why aren't you moving the time?
Mhm.
And use
So
some common
We
sense.
have to
That's
call
what we-
Alex if it goes beyond an hour.
Common sense.
Common sense.
Common
Yeah.
sense.
Common
If it's
sense.
40, if an hour and 10 minutes.
An hour and, yeah, exactly.
Yeah.
Okay.
Use common
Yeah.
sense. It's a couple
Yeah.
hours or whatever your,
Okay.
whatever your
Right.
benchmark is.
Right,
Yeah.
right.
Okay,
Yeah,
interesting.
so-
Lots
Yeah,
of
we'll
common
cover your-
sense in that.
CYA. CYA.
I just like you.
I just.
So, okay, let's
CYA.
CYA.
Yeah.
Okay, the next category, in our books, page 11, the appetite stimulants, okay, we use these. We don't really need them for most of us, but, and for the most part, if somebody has, a cancer or something, we'll sometimes wanna stimulate appetite. And the only one you'll see is Magesterol. And here's one thing that we see sometimes, it's just a little thing to think about. Magesterol liquid comes 40 milligrams per ml. In order to get appetite stimulation, you need 400 milligrams. So the dose is 10 milliliters to get to 400. And we'll oftentimes see doctors write for 40 milligrams, and we'll always call it because that's a wrong dose. It won't do a darn thing. So you got to get that up to 400. So that's the other. ADHD, the only thing you'll see in the elderly is occasionally these drugs, Ritalin, methylphenidate, or dextroamphetamine, they're used for refractory depressions in the elderly. Somebody who we can't treat with depression, if we give them a stimulant, sometimes it works. So they'll give a trial of Ritalin in the elderly for depression. So you may see that. Okay. The blood forming agents, these are things that help increase red blood cells. It's kind of a tidbit about them. These are the drugs that if you follow any sports at all, in bike racing, Lance Armstrong and all those guys that do the Tour de France bike race, this is the stuff they used to inject to help them perform better. What they do is they increase the red blood cells, you can carry more oxygen, you can pedal harder and longer. The problem was that these are all natural things, so they could never test for them. So these guys cheated for years, okay? Now, I'm not saying Lance Armstrong cheated, but chances are he probably did. So what the drug companies did, this is kind of cool, you can share this at your next cocktail party, is the drug companies put another chemical into these that they could test for, and these guys didn't know it. About 3 years ago, about 50 people got booted on the Tour de France because they worked with the drug companies to put a marker in to test for. So just a little trivia you can share with your friends at some point, okay? The next bunch of categories are all the heart medications, okay? I'm not going to make cardiovascular people out of you. I just want to tell you, because they're complicated stuff. But the major side effects you see with these kind of drugs, and I'll get some specifics too, but when the drugs that we use to treat heart disease and we use to treat blood pressure, the major thing you want to watch again is falls, okay? Because when you lower somebody's blood pressure, they'll stand up, it's all happened to all of us, you stand up too quick and you want to faint. Well, the reason for that is because when you're sitting for a long period of time, or the blood pressure medications open the blood vessels, so blood pools in the lower part of your body, in your legs and things. Your body's feedback is wonderful. It's amazing what our bodies do. But when we stand up too fast, our brain doesn't get enough blood. So the brain says, hey, in order for me to get more blood, I'm going to use gravity to pull the blood back. How do I use gravity? I cause you to faint. Okay, so you faint so that your brain can get more blood. It's as simple as that. It's pretty cool the way our body works. Well, the blood pressure drugs do the same thing. They cause the blood to pool low. People stand up too fast, especially in the morning. They get dizzy, down they go, and they bust a hip. Okay? So just be aware of those kinds of things with most of the blood pressure things. The other thing I want to talk to you about is the category on the top of page 12. Those are the ACE inhibitors. Our friend on the Lisinopril over here. Okay, any drug that ends in pril, those are called ACE inhibitors. We use them to treat blood pressure. The major side effect that you'll see with this drug, and it's not major, but it's very frequent, is a dry cough. Okay, you're very fortunate. About 1 out of 10, okay, is that people will get a dry cough that just won't go away, and they'll hack and hack no matter what you give them. You know, I've got a patient at a place that drinks a lot of Delsum. She's on Lisinopril. Got to get her off Lisinopril. Okay,
I would
mean, it
stop
just does that.
taking it. I would
Yeah.
try something else.
Right, exactly.
But,
Well, there's another category you can give to replace it. But just kind of a funny story. One of my pharmacists, last day after Thanksgiving last year, his house burnt to the ground. Tragic thing, and we couldn't find him for half an hour. We thought he was inside, but that's another story. So he goes to his meeting with the adjuster for the first time, and he says, "Lenny, you won't believe this lady hacked and hacked and hacked. I thought she was smoking butts, and then and she got finally." He says, "I looked at her and I said, 'What are you taking for drugs? You take any meds?' And she came up with Lisinopril. And he says, 'You need to talk to your doctor to get on this drug versus that drug, blah, 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 blah.'" She's been coughing for 2 years. Next meeting, she comes back, she gives him this hug. "You're my hero." They changed. I've stopped coughing. He hasn't had no problems with his adjustment at all. I mean, she has taken really good care of him.
what I find curious too is like I was on atenolol for years,
Mhm.
and I never had a problem. Absolutely never had a problem. Switched doctors. He decided he's going to take me off the atenolol and put me on the lisinopril. Now I didn't have any problems with the lisinopril either, but I don't understand sometimes. Well, if you're with one doctor and you're taking something and it's working for you, and you're not having any side effects, and then you go to another doctor
He
and he
prefers a different
decides.
route.
Yes, he decides that he's
It's preference. Yeah,
his
that's it.
preference though.
Yeah.
I'm the one saying no.
I'm sure you could have talked him out of it.
Yeah.
Sometimes you can
Find
see
it
a lot of
interesting.
weaknesses with atenolol that you don't
Oh,
see
is
with
that
the
what
ACE.
it
Yeah,
is?
you
I
can see
wondered if
exercise
that-
intolerance where you can exercise.
Oh,
There's a lot of things you
okay.
see with
All right,
atenolol you
maybe
don't
with
see
the
with
frayed
the
long term.
lisinoprils.
Yeah, maybe.
Probably leads to
Yeah.
that. So that's the cardio's just, you know, remember if somebody's coughing like crazy, look for a Prill on their chart, okay? The this is on page 12, the anti-arrhythmic drugs, we don't really use those, tons of side effects. If somebody has an arrhythmia now, we give them a pacemaker, so it's rare we see those meds. What's the other one? Nitroglycerin's on it, digoxin. Digoxin we talked about a little bit with, if somebody has too much dig and the dig's toxic, you're gonna see two things, you're gonna see a loss of appetite, and they'll see things in front of their eyes. They'll see floaters type of things, not floaters, but they'll see lights, flashing lights. So if somebody complains and all of a sudden they're not eating, pull a dig level to see if they're doing anything with that.
Now I got a question about all this heart stuff. Let's say I took nitroglycerin.
Yeah.
Nitroglycerin.
Yeah.
And if I don't take it all the time,
Mm-hmm.
is there an expiration date on that?
In the old days, the little bottles of nitroglycerin, once you took that cap off, if you put it on your tongue and it didn't sting, it wasn't any good. That changed. They were able to make it more stable probably 20 years ago now, because
Okay.
those thoughts are still around. So it's as good as the expiration date on the bottle.
Oh, okay.
Yeah, there was a time when if it didn't sting, it wasn't good. That's not true anymore. Okay.
That was just a curiosity question.
Yeah, that's okay. That's a good question. With nitroglycerin, which is obviously used to take down chest pain or angina, one of the side effects you're always going to see when somebody starts on nitro for the first time is a pounding headache. For the first, maybe up to 3 or 4 doses, they'll get a pounding headache. So why does that happen? Your heart, remember your brain, causes you to faint when it doesn't get enough blood. When your heart doesn't get enough blood, you have angina. So what nitroglycerin does is it opens the vessels in the heart, so your heart gets more blood, the pain goes away. Again, it doesn't just happen at the heart level. If you've ever had a migraine or an ice cream headache, okay, where you get that pounding headache, here's what happens in your brain when that happens. When you have an ice cream headache, or a migraine, the first thing that your brain does to protect itself from cold is to constrict its blood vessels. Okay, with a migraine, the same thing happens, we don't know why, but the blood vessels in the brain constrict. If you have migraines, you'll see those funky things in front of your eyes, or you lose half your field of vision, and that's your warning sign. With an ice cream headache, same thing, you get this little constriction. Then after that, the natural reaction of the body is to dilate those blood vessels. When those blood vessels dilate, you get pooling of the blood in the brain, and you get that pounding ice cream or the pounding migraine headache. Well, what happens when you give a nitro? You give open blood vessels on the heart, open blood vessels in the brain, and you get a pounding headache. So you'll see that with nitroglycerin along with.
Okay.
That's kind of the over on the heart. There's just so much detail around those things. I'd never get it right. Chemotherapy, you're not going to deal with that. Hormonal agents, we don't do a lot of hormonal replacement with our folks, so we don't really have to talk about those either. Cholesterol lowering drugs. There's 3 classes of drugs to lower cholesterol. They all work a little bit differently. So if they have one from category A, one from column B, that's okay. If they have 2 from column A, it's not good. Okay, you'll have duplicate. But they all work to reduce cholesterol. The only side effects I want to tell you about is with the statin drugs. That's Lipitor, Simvastatin, Pravastatin, those drugs. And for some reason, those drugs can cause increased muscle pain. Well, the fancy term is called rhabdomyolysis. And what happens is, you'll have weakness and pain in your muscles, okay? And there was actually several drugs that have been pulled off the market, and they looked at possibly pulling Simvastatin in high doses because of it. So for some of your residents, all of a sudden I'm weak, I've got muscle pain, check to see if they're on a statin, because that will,
Will that
Could
come
be
on
a-
like suddenly or just when
yeah,
it's
you can see it, it may be sudden, it may be over time,
Can it
but,
cause one side to be
Leave
more
it
weak
takes
than the
steps
other?
Sure.
down.
yeah,
That makes
Couple
so
can
much
take it.
sense.
Harry takes it.
so that's cholesterol drug.
Covers that.
Page 14, I want to spend a little bit of time on diabetes,
Yes.
okay? Diabetes in our country is becoming epidemic, okay? I'm gonna preach to you a little bit, the Baptists will come out in me here a little bit, but I'm gonna preach to you just a hair. There's two types of diabetes. The first type is type 1, we used to call it juvenile diabetes, is where your pancreas for some reason stops making insulin. The beta cells, either it's genetic, there's a virus that's hit your pancreas, you have beta cells, and you get no insulin. So the only treatment for that is insulin shots, okay? Now with insulin, there's all kinds of insulin. There's long-acting, ultra-long-acting, short-acting, ultra-short-acting. Typically what we're seeing more and more is you'll get a long-acting insulin like Atlantis given at night, and then some Humalog or some fast-acting insulin given at meal times. We're seeing more and more dosing like that. From a storage perspective, I always get asked this question. I left my insulin out of the fridge. Is it any good? Okay. Insulin can be kept at room temperature for 28 days without a loss of potency. So if you keep it out of the refrigerator one night, it ain't a big deal. In fact, we almost sometimes say it's better to inject room temperature insulin than cold insulin. It doesn't hurt as much, you don't get as much tissue damage with it, okay?
The new pens say not to refrigerate after they're open.
That's correct, you want, because you want them for that reason. And pens, from a pen standpoint, you guys, the resin has to be able to dial their own pen, okay? They have to be able to dial their own pen. You can verify it, but they have to dial their own pen, okay? The state's very specific in that, okay? So that's type 1 diabetes. Type 2 diabetes, which is, we used to call adult onset, although we're seeing it now in late teenage kids, is where you have enough insulin, but for one reason it can't get out of the pancreas, or it gets out of the pancreas, it can't get into the cells to do its job. So we give the oral medications, the metformin, the glyburide, those all either squeeze it out of the pancreas, or they help it get into the cells to do its job, okay? Here's my lecture on diabetes, okay? Adult onset is virtually 100% preventable, okay? And you prevent it with good diet and lots of exercise. Anybody watch Biggest Loser? And what they do with those people and getting them off their diabetic medications. Exercise is truly the key to everything, okay? I've got a crap diet, but I exercise like a fiend, okay? And it really, you can prevent it, and you can get it. If you're not walking, start walking. I mean, do
I walk 3
something.
miles a day.
Excellent. You really, it's the best thing you'll ever do. You'll feel better mentally, and you'll prevent diabetes. I have a brother, my oldest brother. I can tell this story, okay? But my oldest brother is 25 years retired Navy guy, okay? And he talks like a sailor, okay? He acts like a sailor and talks like a sailor. And a few years ago, he called, that's probably 5 now, and he had been diagnosed with adult onset diabetes. And he's also one of those people who are very, compulsive, and I'm gonna fight this. And so he exercised, he'd walk 2 miles 3 times a day. He did his diet great, and he really controlled it, didn't do anything. He called me and he said, well, they put me on a med. I said, well, how you doing? Well, not so good. He called me a couple months later. I'm going on a second drug. I said, hey, what's going on? I said, are you exercising? Well, not really. So how's your diet? Well, not so good. I said, Edward, you have to exercise. And my brother, now he's 25 years in the Navy, looks across, and he's petrified of needles. He doesn't want to go on insulin. He's petrified of needles. It was this macho man. And so he yells across the room to his wife, Debbie, Lenny says we need more sex. Debbie, not to be outdone, says, I guess you're going on insulin. So anyway, I tell you that to say, you gotta exercise. I mean, it is really key to really preventing, because it's totally preventable. And once you have it, it's gonna get worse. I mean, there just isn't a cure. It's gonna continue to decline. So anything you can do, and it's a quality of life thing. I just sort of lectured a 2-hour lecture on it recently. And it truly is just a quality of life. If you end up with diabetes, your quality of life really declines. So you're better off doing everything you can to prevent it. So.
If you're healthy in a lot of other ways, but you just like your sweets, I mean, is that what's gonna bring you there?
May not, if you really, the lecturer says, I don't care if you eat a cupcake, just make sure you run an extra 3 miles that day.
So it's not,
I mean,
it's not
literally, and
eating
it
a lot of
hasn't been
sugar.
proven, it's not a lot of sugar, it's all on how you metabolize. Now, over time, it may be,
right, yeah.
because you're gonna burn out the cells in your pancreas, because they have to respond so much by putting out more and more insulin. But for some reason, exercise allows that to happen for some reason, prevents a lot of that what goes on, so.
I have a question about, I remember my mother-in-law, I used to come up from the nursing home, the nurse at the nursing home showed me how to give her insulin shots.
Mhm, yeah.
I remember having to, like, make a,
Yeah,
Pinch it.
sure,
and
yeah,
then,
and just pop it. Mhm.
and then stick it with a needle. Now, do you do that with the pens nowadays too? Or do,
Pens are so good.
or the
The needles
residents,
are a lot smaller.
The needles are a lot smaller.
but can they just push themselves like they do, or do they have
You
to
could,
make
you
that?
could tell your resident to put the needle against his stomach,
Mhm.
take a deep breath, and lots of times that needle will go in, they won't even know it. I mean,
So we
that's how
don't know
far
that.
advanced the needles have come in the last 5 years. They really.
So it's no big deal that you have to get that, okay.
No, and it's usually in the gut anyway, is where most people are doing it now,
Yeah.
so. The needles are so much finer, it's almost as
Oh, we were
close to
talking
pain-free as
about
you can.
10 years ago, so.
Yeah. Did you have to sharpen them and everything at the end?
No.
Okay, so that's really diabetes in a nutshell, and why you can't give a tablet to help with somebody who's got type 1 diabetes, because there's no insulin to force out and force in. So that's why there's no oral medications for type 1 diabetes, okay? The next several categories are diuretics, those take fluid out of the body, okay? Lasix, all those wonderful things that
Dog Lasix.
makes you puke.
Teresa likes
Okay.
Lasix.
Anyway.
Oh, no, I take my own version, I'm not liking
Yeah, they
it.
all do it. The key with those drugs is you want to make sure that your potassium is in balance, because when you
How do
pee
you
a
check
lot, you have to check your potassium level.
And a lot of
Um,
them seem to take Chlorcon with the Lasix, is that why?
That's potassium
That's
supplement.
why?
Yeah, it's a
Oh,
potassium
that's what-
supplement.
okay.
So your
But
doctor
what
can
happens-
test for potassium?
Yeah, you have to do that.
Isn't that
And what
you
happens
float?
is that when you take fluid out, you also take electrolytes out. And potassium is key to muscle function. So if you've got leg cramps,
No.
you might have some leg cramps. I'm not going
My
there.
eyes twitch.
Yeah.
Is that
yeah.
potassium?
Yeah, possibly. But what happens is potassium is mostly responsible, and it has heart function in it. You remember Karen Carpenter and who died? She died because she went on a liquid diet and depleted all her potassium and had a heart attack. Okay, so you want to just make sure that you're looking at potassium if you're taking a diuretic for a long term.
What about
Short-term
restless
use,
leg
it's not too bad.
syndrome? Restless leg syndrome, is that linked to potassium?
No, it's linked to
No.
dopamine, actually.
Dopamine.
Yeah, the
But that's a
neurotransmitter.
scary drug, that's the one where you get up in the middle of the night and you eat, right?
Oh, no, that's Ambien.
No,
We'll get to that.
that's
Yeah, that's Ambien.
I thought there was
That's
some,
Ambien.
They give
Okay,
you that
yeah.
I'm trying to remember what the
because I
name
couldn't
is, there's a
sleep.
drug that my doctor
And
wanted
I-
to give me for restless leg syndrome, and I didn't want to take
Ropanol,
it.
and that will wake you up a little bit.
That's what
Yeah.
I saw it, but you don't get up and you don't realize you're eating.
No, that's Ambien. We'll talk about
That
that.
didn't happen to me when I was on
We'll talk about it. Anyway, we'll get there, okay?
They
But that's diuretics. You want to make sure you're looking at potassiums. Page 15, we don't have to really look at the first category there.
No,
We don't
no,
use
no,
a
no.
lot of those in this business, okay? I just
Well.
saw,
You never know.
next crowd.
This is true.
I just saw Bill Cosby live a couple months ago, and he does a great thing on that category of drugs. I won't spoil it for you, but he's pretty funny.
Oh, I love
Which
him.
category is that,
anyway,
dopamine?
The next category are antacids. Antacid drugs, Maalox, those things. Two side effects with antacids. One is diarrhea. The other is constipation. You say, how does that happen?
Take too much, you get more.
Now here it is. In Maalox we give aluminum hydroxide and magnesium hydroxide. It's a combination. Magnesium gives you diarrhea. Aluminum gives you constipation. We hope you get a balance between the two. So that's what
That's
you
why
get
if I
with
drink
those.
too much,
Yeah.
I relax.
But can I ask you one question? I just
Sure.
want, so if you have restless leg syndrome, because I have it really bad, I mean, I have to go to bed because my legs start kicking in the
Yeah.
chair. You need dopamine or you have too much dopamine
I
in your
think you
brain?
have. I think you need it.
Oh, you
I
need
think
dopamine.
don't hold me. Yeah,
And then
because think about it. With Parkinson's, you get tremor because you
Right,
don't have enough, and the
right.
same thing with
Oh.
restless leg. You need
That makes so much sense.
So, yeah. The antidiarrheal drugs, loperamide and diphenoxylate, they block acetylcholine, anticholinergic. So they slow down the intestines, dry mouth, all the things that go with it. emetics, the anti-puke drugs. The best one you'll see there is Zofran, great drug.
I love that.
Zofran's
So expensive.
fabulous. Well, no, it's not anymore.
Oh, it's
What does he
not?
do?
Last time I had
Here's, here's a great generic drug story. Zofran, when it came out, was $40 a tablet. The generic is a quarter. So it's
I
generic now.
tried to
It's
get it like a
cheap.
couple months ago and it was still like $100.
Well, it's the generic is really fairly reasonable. I don't know
It's
how you get the
Ondansetron,
prices.
right?
Ondansetron, yeah, it works really well. Simethicone, that's a gastro drug, slows down breaks up the gas bubbles in the stomach, not a lot of side effects. Dicyclamine, you may see category in the middle of page 15. That drug slows down the intestine if it's moving too fast. Hyoscine is what we use in hospice for secretions. Lots of times Levsin, so we'll give that sublingually if people start to secrete a lot. Again, blocks acetylcholine, dries out the mouth. Okay. IBD, we don't really talk about those drugs very much in our business. Category 6, on page 16, laxatives. It's a rule if you're in one of these buildings, you have to have 2 laxatives and a bisacodyl and a Docusate. I think it's,
Yeah.
for some reason, I don't know.
Is it
What do
really
you-
a rule, or are you making
No,
a
he's
joke?
messing with
Oh,
you.
yeah, you're making a
I'm
joke.
making that up. Are you kidding me? I'm sorry. No, are you really that gullible, huh?
It's the senior obsessive disorder, right?
Yeah, it's
Senior
senior
obsessive
obsessive
disorder, yeah.
Here's the deal. If for proper bowel function, you need 3 things. You need good fiber, you need good hydration, and exercise. Okay? So what happens is, fiber's easy. Exercise, if you keep them moving, it can be easy. The problem is
They don't
hydration.
like to
The
drink.
problem is hydration because you've got these little old ladies who are 75 and they sneeze and they pee. And that's exactly what happens.
They pee when
And
they
so,
sneeze.
and so you tell them, okay,
As
okay,
you
dear, you need to drink 64 ounces of water a day. Yeah, okay. Yeah, not gonna happen. So
Just have
and
to sit
they
up.
end up with constipation.
And they
that's
prefer
as
to
simple.
drink soda, and they're drinking
Oh, no, nothing wrong with
caffeine,
soda.
Pepsi. Well, isn't it a diuretic, like the caffeine and
The
the
caffeine and the
caffeine.
Pepsi will do
It's-
it.
They
That'll
prefer
make
to
it a little
drink
bit.
that.
So
Oh,
anyway, but you won't get them to do a lot. So you end up with, the colaces and all of those things. To help with the bowel issues. And I had
That's
somebody
so
ask me,
well.
somebody asked me in one of these classes once, I have somebody who chews a Docusate. Think of, well, Docusate is soap. I mean, it really is, what it does is it draws water into the intestine. It's
Everyone
soap.
used to
It's like,
think it's
liquid
soap.
soap in your kid's mouth when they're fresh, it's just chew a Docusate. I mean, but that's, you can chew, it won't
Like
hurt
with me.
anything, so,
Oh.
anyway. But that's really all about laxatives, okay, not a lot to say. Pancreatic stuff, I mean, there's not much to say there. Metoclopropamide, which is in category 16, that drug helps the stomach to empty. It does a pretty good job. You'll see it 3 times a day around meals.
What is it?
Metoclopropamide,
Oh, I see it.
yeah. One of the side effects to that, though, can be that tardive dyskinesia we talked about with the tongue hanging out and those kinds of things. So if you've got somebody on it, make sure you're looking for any movement type of disorder.
No, what is that for?
It's to empty the stomach. It causes the stomach to empty faster. Yeah,
I
no,
don't
no,
take that.
No, okay.
I know, but you have a lot of gastro trouble. Who knows?
The protectants, the GI protectants, okay? That's
Say
sucralfate.
thanks, Mom.
Yeah. That
I
may
know
help
you
you. Sucralfate helps restore the lining to the stomach.
There's no hope for mine.
Okay, well, just a hint.
No, she got no hope. No,
Okay.
there's nothing.
The next category, the protein pump inhibitors, all those do is
Ask her
lower
about 'em.
lower the amount of acid in the stomach. Those are the over-the-counter
That's
Prilosec and those drugs. Not a lot to say. Estrogens, we don't give estrogen to our folks. They're past that, most of them. The thyroid drugs, again, those are the narrow therapeutic range. You got to make sure they're on the right dose, so it should be tested on somewhat of a regular basis. Category page 17, the hypnotics. Nothing to say about the first class. We don't even use them anymore. But the second class, Ambien, we talked about. It literally has been documented that drug can cause sleepwalking.
I never
It
had
can,
that.
yeah, you're fortunate. But it literally, you can wake up in the middle of the night and not know where you are. One of the Kennedys used this as a defense to drunk driving. I don't know if you remember several years ago.
Oh, I remember.
He said, I took an Ambien, I was in bed, and all of a sudden I'm driving my car. I That's pretty good lawyering. I don't know if he really got out of it. But I did have somebody in one of my classes say, they literally, his father-in-law got up and ate a half an apple pie.
I've heard
and didn't
that.
even-
I
and
used
did
to
not,
when I was
and
young.
did not do it,
And they
did not
don't
realize
remember
it,
that
don't
they
remember.
I used to
So-
see things flying across the ceiling. I was telling
Yeah,
you, I
that's-
had like a twilight turtle constellations in the ceiling, and I used to sit there pregnant at night,
Watching.
awake, staring.
Oh,
I'm like,
pregnant.
honey, look, there's butterflies going across our
That's
room. He's like,
scary.
you're losing
That's
it.
really scary.
Get rid of that drug.
Yeah.
Okay, the next category, the iron replacement drugs. The only thing with ferrous sulfate that you'll see is it can upset the stomach, so you want to make it with food, and it can cause the stools to be very black and tarry looking, so
Oh,
you
yeah.
can do that. So, MS drugs, nothing to talk about. Those are all injectable. The ophthalmic agents, those are all eye drops. Again, just good technique. Not a lot of side effects with those because they all act locally. Page 18, I want to
I
spend
do have a question.
Sure.
Flow.
off floxin.
Yeah, that one.
Mhm.
Can that cause like dryness? Can it cause you to itch?
I don't know if it would do that because I don't know how much absorption you get with that.
Right.
Probably not.
Okay.
That's a guess, but might not. On page 18, the top of 18, I want to spend just a few minutes talking about osteoporosis because again, we want to talk about preventing fractures. And the drugs that we use to prevent fractures are the biphosphonate. So the Fosamax, Actonil. You've seen them, they come in packs of 4. And you take them, you have to take them an hour before you eat with 8 ounces of water. You don't sit down, you don't lay down. That's good pharmacy. Okay, and here's the reason why. Fosamax or Actonil can literally burn a hole in the esophagus. Okay, so you give them with 8 ounces of water, so you get it all the way into the stomach. And then you say, sit up, because you don't want the person to reflux back into the esophagus. So that's why we do and tell you to do what you do with those. And it doesn't happen all the time, but it certainly can. So that's good pharmacy, and you ought to be doing that with your folks when you give that drug.
What was the drug again?
Fosamax Aldronate is the generic name, or Actonil.
And do they really work? Do they build bone evenly?
There's some question about that. You have to have calcium with them, and you have to have vitamin D with them, and that will help lay down bone. There's been some studies recently that show 5 years out, we're seeing fractures.
Exactly.
Because
Is
they're
it
not
uneven
doing-
bone growth, like you've got some strong
Yeah,
bone here?
yeah.
Because I have osteoporosis, even at
Mhm.
my age, I
I'll
have
tell-
osteoporosis.
I'll tell you a story about that when
I
we finish.
only take Citracal.
Okay.
I take a lot of calcium, I take a lot of vitamin B. But
D.
I will not take vitamin D.
Mhm.
But I will not take the Fosamax.
Weight bearing
even though my
exercise, do you
doctor-
do weight bearing exercise?
do.
Okay,
Yes, I
here's
do.
a story, okay,
Uh-huh.
it's again a wife story, okay? My wife is 54. 4 years ago, she was diagnosed osteoporotic, and significant. And they put her on Fosamax. 3 months into it, one Sunday morning, she said, I think my back is broken. And there's a side effect that we found out later that is, it feels like a fracture from those drugs, Fosamax, Actonil. And I said, we gotta get an x-ray. So she went to the doctor the next day. Nothing was wrong, but it was a side effect of those drugs.
Like a
And so-
growing pain?
That's almost what you would describe it, but she could barely get out of bed.
Right.
I mean, and
right.
she's classic, she's small, she weighs 100 pounds, I mean, she's just teeny.
Small bone.
And so a friend of ours works in our retail store, does natural pharmacy stuff with us, over-the-counter calciums and all that good. I always called her Hocus Pocus. I said Hocus Pocus Sally is what I called her. And I grew up with her, so I know her for a long time. So I always give her a hard time about that. She said, you send your wife to me. So she went down, she saw Sally, put her on just calciums, high dose calcium, vitamin Ds, lots of weight bearing exercise.
Right.
Last year, her osteoporosis is gone.
I believe it.
And I had to
believe
eat
it.
crow with Sally.
I don't think you
I
have
mean, it
to
was
take
just-
that Fosamax.
it-
It scares me. Yeah.
I don't think that's a bad idea. Okay, that's between you and me and the wall. But
Yes.
there is some issue around Fosamax and fracture.
I've seen a lot of
So,
class
mhm.
action commercials about that.
Yeah, my
There you
mom
go.
took it. and
So,
I just-
but the bottom line is this, is that if you're young, drink lots of milk or take some calcium.
right.
If you're older, your folks are in here, bump up their calcium and make sure they're not falling because they fracture hip, with that. So we want to do that. The next category is potassium. Again, not a whole lot to say about potassium, just make sure they're taking it with some food. And it can upset the stomach a little bit. The next categories are all respiratory drugs. They all either open the lungs up or they act like steroids. And we talked about good inhaler techniques. That's really the key to all of these. The nasal ones too on page 19, same thing. They all act locally. The skeletal muscle reactions, the only one you're gonna see there is carbidopa, caricipridol, I'm sorry, cyclobenzaprine, Flexeril.
I take that.
Yeah, that will knock you on your can a little bit, so be aware that Flexeril will do that. The oral steroids, the prednisones and those things, we use high doses of those for inflammation, sometimes respiratory disease. And you've all seen that where you take prednisone 7, 6, 5, 4, 3, 2, 1 or declining dose. Here's the reason behind that, just so you know, is that your body naturally produces steroids. The adrenal gland produces, you need a certain amount of steroid in your blood or in your body. And your body naturally produces that. So when we take somebody who's got either a poison ivy or some sort of thing or a high joint disease, and we want to give them a high dose steroid to knock that down, what happens is when you give that high dose, your adrenal gland says, oh, I don't have to work now because I'm getting this orally, okay? So we give them a low dose so that by the time they step down from here to here, your adrenal gland is kicked back in and is working normally again. So that's why we do it. And I've seen a case where they stopped steroids too quick and a person had a real brainstem issue. So stepping them down is good medicine. So you know that.
I know one of the side effects is a moon face. I'm sorry, but what is a moon face?
It's a moon face. Your face gets round. You get edema of the face. Is what you get.
Swelling?
It's swelling.
Swelling in your face. Okay.
Yeah. So
alright.
it literally looks round.
You get puffy.
Yeah.
Oh,
Yeah.
okay.
Yeah.
You'll know it if you see it.
Okay.
You also can
alright.
see buffalo hump. They get a little hump on the
I
back.
haven't seen
You
that.
I've
can
never
see
had
that. You can see that. So.
Okay.
The topical steroids, those are the creams that you use for itching and rashes and those things. Just one thing about those, a little bit goes a long way. So just take a little bit and rub it on well. If you put it on thick, it's like a waste of it. And some of these are $150 a tube, so you don't want to do that. Oxybutynin, we talked about those things that block acetylcholine in the
And you should
the
double dose
bladder.
Maryland.
Okay. BPH, you've seen the commercials on TV, men over 50, when they get over 50, their prostate grows. It's not a going problem, it's a growing problem. So, you've seen those ads, that's good ads. So these drugs actually shrink the prostate. The thing about these drugs is if you're young, you don't want to handle them. Okay, this question about handling those young ladies' potential birth defects with them. So if somebody's on Proscar or finasteride and those, you don't want to hold them. You shouldn't be handling the meds anyway, but just be aware of that. And urinary incontinence, we talked about with how those drugs work by blocking acetylcholine in the gut, and they work really well, okay? You're all now qualified to be pharmacists. You want to take the board? Good luck to you, because I couldn't pass it now. So, just a couple more things in this book. There's a good chapter, medication and relationship to food, what to take with food, what to not, drugs that cause weight loss, and those kind of, it's good reference. The other thing is, on page 47 of the yellow section, there's a good listing of drugs not to crush, okay, which is a good practical thing. And here's just a general rule about crushing medication, is number one, you don't crush drugs that are long-acting. Because drugs that are long-acting are made to dissolve at a certain rate, and so when you crush them, they all come out at once, okay? And then the other class of drugs you don't want to crush are drugs that are enteric-coated. That means like an enteric-coated aspirin. Those drugs have a special coating so that they don't dissolve in the stomach and upset the stomach, they dissolve lower in the intestine. When you crush them, you obviously get rid of that coating and you can get upset stomach. So that's the book. It's really good.
I like
It's
this
a great reference, so it'll do you well. So we're at 4 o'clock. I told you I'd finish early. Give me about 15 minutes and we'll be done. Okay, we'll talk about documentation and we'll talk about infection control. Okay,
We're good with the book?
what's that?
Good with the book?
Good with a book. You can put it away. Okay.
That's my big bag of fun stuff.
Okay, documentation. Okay, and this is the key. And I'm sure it's been preached at you and said to you 100 times. If it wasn't documented,
It didn't happen.
okay? I want you to, that's all you gotta remember. Get it stinking done. I mean, I'm telling you. And when the state walks in here, they're gonna look at your medication sheet and they're gonna look for holes in that med record. You can survey, do you know what they look at? And they literally, and one of the things they said to me this fall was, we're seeing a lot of places with holes in their med records, okay? You gotta sign the record, okay? You got to, okay?
I have a good question.
Yeah?
What do you do if, like, say Christmas time comes and they're going out for a long period of time, but you're handing them those medications? Supposed to sign for them? Or
No, no. No, what you need to do is document they were out of the facility. Meds given, out of the facility. You can document it on the med sheet. I recommend blocking out the time on the med sheet, LOA, gone away, making a note somewhere in the residence chart that's easily accessible that says they were gone.
Can
Okay?
you give them the bottle?
We'll talk about,
Okay,
we'll get there, let's just go, we can go
Okay.
quickly through this, you guys all know this stuff, probably, well,
Not really.
hopefully you do, okay? But you know about documentation, okay?
Yes.
When you sign that med sheet, you're saying you've observed the 5 rights, I gave the right drug, blah, 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 to the right patient at the right time, so forth and so on. You need to sign every medication you give. There was one point that the state was, that the Board of Nursing was saying, you could sign off and say, I gave AM meds, well, that ain't gonna cut it, okay? You need to sign individually. I'll leave your certificate here.
Bye, I have meds to do.
She's got things to do.
Do them right. That, where was I? I totally lost it.
Sorry.
That's
Signing
okay.
AM meds only.
Signing AM meds only, you can't. You gotta sign for every single individual med on that med sheet, okay? If somebody doesn't take the med, circle it, sign, put refused on the back. If they refuse, you can go back 5 minutes later, would you like your med now? Oh, yeah, no.
So should we not write refuse till we?
I would,
try?
until you know for sure they're not gonna take it,
Yeah.
okay? But don't forget to go back and do
Oh,
it.
yeah.
That's the key, you get busy somewhere else and all of a sudden there's a hole.
Yeah.
But documentation, if you, again, like we talked about before, if you don't sign off on that PRN and somebody comes along behind you, they're gonna get another dose. Okay, so it's really, really important.
We don't only sign off on it, they have to write the time. That's important.
And
Because
did they put a
it-
reason on the effect on the back?
Absolutely,
Beautiful.
absolutely. It has to have
That's
the
what you want.
reason why they're taking
Yep.
that PRN
Good,
and the time it was given,
yeah,
or else it's not effective. It's
that's
some,
right.
Right.
they need to know whether
Absolutely.
they can take it in so many hours or
That's right.
whatnot. So
Yeah.
yeah, we need both those
Yeah,
done.
and again, on your record, I put